Good afternoon, you guys. This is another video related to nursing. Today I wanted to talk about students in nursing school, or I want to talk about those of you considering going into nursing. I wanted to share a few tips with you. I think it's very important and some things that you should consider before going into nursing school. I can tell you that, for example, here in South Florida, nursing doesn't get paid very well. The salary here, it doesn't really compensate the cost of living. So the salary in nursing in South Florida is very low. I know other states, the salary is a little bit better, but my understanding is that Texas and South Florida, it doesn't really pay too much, especially HCA companies. HCA companies is Hospital Corporation of America. They don't pay too well. So, once you graduate from nursing school, just make sure where you apply and make sure where you're going. One thing I wanted to mention before starting to give you tips is that if you are going into nursing thinking that you are going to make a lot of money, that is a very wrong mindset, because you really have to like nursing in order to do this job. It's a very difficult and demanding job, and you have to deal with a lot of things at the hospital and outside the hospital, and it's not easy. So on top of that, for example, here in South Florida, you make good money in nursing only if you do a lot of overtime or if you have 2-3 jobs. Other than that, unless you are in nursing for a very long time, that you accumulate in your salary. But if you're a new nurse in South Florida, 1, 2, 3, 4, 5 years, you are going to find yourself not making enough money to pay the bills. Unfortunately, that is the truth of nursing. I know that a lot of people think that they're going into nursing and they're going to get great amount of money, but trust me, my personal experience and with my friends, that is not necessarily true. Of course, it also depends where you work, where you live. So I can only talk about my experience about myself. Moving on from this topic, I wanted to tell you that nursing to me is a very rewarding career. I was a medical assistant for almost 11 years, and I always knew that the next step in my life was getting a bachelor's in nursing. So I did. I went for 4 years into nursing. I got my bachelor's degree, and I'm very happy with it. Even though my job is very difficult, the hospital that I'm working is very demanding and difficult, but it's something that I still do like, and I will do it all over again, really, if I have to. I wanted to share some tips with you about nursing students. I'm only a nurse for almost a year. I've been working for a little less than a year, and I don't have a lot of experience, but good enough to tell you a few tips and what the real life in nursing is. I wish I could see videos like this more in YouTube, but a lot of YouTube videos is related to nursing but other topics. So I just wanted to tell you the reality into nursing. Nursing school is very demanding. It's very hard, and I wish I could have someone to tell me a few tips that to me by logic are things that I know I have to do, but this is like a constant reminder to you all who's going or are in nursing school, the things that you're supposed to do. The first thing you should do in nursing school is study hard. Study hard, because if you cheat, if you pay for somebody else to do something, or if you always do things in group and you take advantage of that, I can only tell you that once you are ready to take the boards, that's where I come to find out that some of my friends or some of the people that I knew from school, they aren't been able to pass the boards. They took it once, they took it twice, and even maybe third time, and some people are having a hard time. I know someone who took the board 3 times, and that person is not allowed to take the boards in the state of Florida anymore. So just make sure that when you go to nursing school, you study and you know your topic, because once you sit in the board, you're not going to pay nobody to do the board for you. Once you sit in the board, you are not going to do it in a group, and you are not going to be able to cheat. It's on you 100%. So you really have to know your topic. Nursing topic, it's something that you have to build up in nursing school. It's not something that you can study at the very last year, or especially at the last semester. You have to start building your knowledge for nursing school since the day one, or even before, because if you can get your textbooks before starting nursing school, a month at least, go ahead and get into the books, start taking notes, because that's how you're gonna start building your knowledge. So based on the things that I saw in nursing school, it's important for me to share with you that please build that knowledge since day one. Do not wait until the end, because you're gonna have a big loan on top of your head. You're gonna have a lot of time and sacrifice on you, and if you don't pass the last semester, or if you don't pass the boards, all of that for nothing, that is very sad. So do yourself a favor and study. You have to take nursing school very, very serious. The second reason is because you also have people on your hands. Once you start practicing, once you start working, you are going to see all these nursing topics that you went through school. You're going to see it at the hospital. You're going to have to rationale why things are happening. When you contact a doctor, you have to talk in medical terms. You have to talk with staff at the hospital. So you're going to see all of this all over again once you start working. So build that knowledge, because once you build the knowledge, later on it's just going to come so natural to you that you're not even going to think about it. So just take care of your patients. Patient safety is our number one priority for us who work in the healthcare field. And I wanted to tell you that yes, nursing school is very hard. Nursing school, it's one of these programs that is totally different from any other program in the entire curriculum career situation. It is so demanding and so difficult. But if you happen to graduate and start working as a nurse, it's a very rewarding career. Only if you like nursing, because if you don't like nursing, you're not going to enjoy this at all. You probably will be quitting nursing, and you probably won't be a happy person. So, make sure this is something that you're really meant to do, and you're really meant to be a nurse. And starting is difficult. It's a lot of sacrifice. You won't be able to share maybe holidays with your family. You probably won't be able to go out and smash. But you know what? At the end of the day, if you graduate, if you pass your boards and find a job, you are gonna have some time to start enjoying holidays with your family. You're gonna have time to go to the mall, or you're gonna have time to travel. Not that you're gonna have the whole time of the world, but because you're gonna be working a lot probably. But and like in the first year, I haven't been able to take vacations, so it's not that I've been taking a lot of time off. But you're gonna have more time, definitely, because when you have to study constantly, even if you have some time off, you still have to be in the books and you still have to study. So I just wanted to do this to give you the tip how necessarily and important is for you to start building the knowledge since day number one. So please do not take this very slightly, because nursing is something that is very difficult. And once you see the tests and exams coming up, then you're gonna find out how hard is nursing. My last tip for you is, for those of you who are going to start nursing school, already nursing school, if you don't make an A or B, but you're making a C, around that grade, not failing, because failing is never good, but if you're not making your A's and your B's, I wouldn't focus too much on your A's and B's. I will really focus more on building that knowledge. Make sure you know topics related to nursing. I will focus more on my clinicals, paying attention of nurses, of what they're doing, paying attention of what your preceptor or your professor of clinical is doing, all the explanations that they're going over. Practice at home, practice at the hospital with your patients. Make sure that you pay attention, because again, you're going to see this all over again once you start working and once you are on your own. Remember, once you're on your own, you're no longer going to have a professor to ask questions. You're not going to have a preceptor. You're going to be on your own. So trying to learn as much as you can when you are in your clinical. And this is from day one. Again, start building your knowledge since day one. When you're in class at school, start paying attention to your professors. Do not take nursing classes lightly. Take this very seriously. You have to open your ears, your mind, your heart, and your soul to nursing. You have to understand what your professor is talking. If you don't understand, raise your hands, ask a question, okay? Most likely you're not the only one with the same question. It's okay to ask questions. That's how we learn as humans. You have to do your research, going to your books, going to YouTube, going to your library. Your local library has also a lot of resources. I was always at the library studying, reading, looking books, and you know, it's very important that you know your resources around you. Take advantage of that. You have to pay attention when you go to clinical. Do not take clinical slightly, because once again, when you're your own, that's the experience and that's the knowledge that you're going to start practicing with from what you built from before. So this is my only 3 tips that I have for you. It's important to build the knowledge from classes, from clinicals, and it's important that you do nursing career, because it's something that you're really meant to be. If it is not a calling for you, do not do it. It's not going to be good for you. It's not going to be good for you at all. So again, this is another nursing topic that I wanted to share with you all, and I wish you all the best. If you do have questions, any questions related to nursing school, relating how to take the boards or how to renew the license, I already have to renew mine within a year. How crazy is that? And I did a multi-state this time. So if you have any questions whatsoever, please write to me. Ask me a question. I'll do my best to answer you. I really wish you all the best, and I wish you all the luck in the world. And with these 3 tips that are very important, I'm hoping that you're going to succeed in nursing school. Until next time with another nursing topic, this is Yoli. Have a good day all.